Here's Deb now in our health news.
Thank you, Tony. It's pretty clear that our health dollars are being stretched to the breaking point, along with our healthcare professionals. In an attempt to ease the burden for everyone involved, an Abbotsford emergency physician has come up with a plan. Instead of shipping patients with wounds that won't heal to hospital, he's now using technology to make a virtual house call. Linda Aylesworth has a look at something called Pixelaire.
It's been a tough year for 91-year-old Ida Pearson and her family. Since hip surgery 5 months ago, she survived a heart attack and a stroke. Now she relies on her daughter for everything.
When I actually brought her home, she couldn't even hold up her head or even keep her tongue in her mouth, or, you know, it was amazing. So she has really, really improved.
But what isn't improving in any great hurry is the bed sores Ida developed from months of laying around in the hospital.
It's still covered. She had one on her foot, and it was the same size as the one on the buttocks.
For home care nurses like Amanda, wounds, whether they're caused from immobility, surgery, diabetes, or any number of circulatory problems, take up a lot of time.
They're very common. I think it's about maybe 50% of our home care load, and we can spend up to 75% of our day dealing with wound care.
Treating wounds is tricky. Even the best trained nurses often require the advice of a specialist. And clearly, getting patients like Ida to a specialist is a major undertaking for her family, which is why they volunteered to be enrolled in a study being conducted in the Fraser Health Authority. With the click of a digital camera, images of the wound are captured on a disc that is fed into a portable computer, then sent, along with vital information, by way of cellular technology to a secure website that experts, in this case at MSA Hospital in Abbotsford, can access.
I think it's great. I think it really enhances the communication. A picture's worth 1,000 words, and I can really visualize what the wound actually looks like.
Great. So it sounds like we've saved another person from coming in.
The system, called Pixelaire, is the brainchild of MSA Hospital emergency room physician Dr. Jonathan Burns. He's keenly aware of the need for innovative ideas that can reduce the stress on the healthcare system as well as on the patients.
The benefit is that then the nurse or the nurse clinician or the dermatologist or family doctor can review multiple wounds at the same time that they would see one. So they get an idea of how things are going with their patient at home. They can send a result back to the home care worker. It saves time and effort.
When the pilot project comes to an end next week, the job of assessing how successful Pixelaire is at speeding up healing and reducing cost will begin. If all goes well, it might one day be used throughout the province.
I think it's phenomenal. I'm really excited. I think it's great news for community patients. It's good news for anybody who has a wound that is slow to heal.